When we think about getting stronger, our minds often jump straight to lifting weights to build our biceps or doing sit-ups for our abs. But there's a group of muscles, hidden deep inside our bodies, that is incredibly important for our overall health and well-being, yet we rarely talk about it. I'm referring to the pelvic floor. These muscles form a supportive sling, or a hammock, stretching from your pubic bone at the front to the base of your spine at the back. They are the unsung heroes of your core, quietly working to support some of your most vital organs, like your bladder, uterus, and bowels. Think of your pelvic floor as the foundation of your torso. Just like a house needs a strong foundation to remain stable, your body relies on these muscles to function correctly every single day. They help you control when you go to the toilet, play a role in sexual satisfaction, and provide crucial support during pregnancy and childbirth. However, various life events can weaken this foundation. Things like pregnancy, the process of giving birth, gaining weight, undergoing certain surgeries, or even just the natural process of aging can cause these muscles to lose their tone and strength, leading to issues that can really affect your quality of life. Unfortunately, a weak pelvic floor isn't something that just magically gets better on its own. When these muscles are not strong enough to do their job, you might experience embarrassing leaks when you cough, sneeze, laugh, or exercise, a condition known as stress urinary incontinence. In more serious cases, it can lead to a feeling of heaviness or a bulge in the vagina, which is a sign of pelvic organ prolapse. The good news is that you don't have to simply put up with these problems. There is a simple, effective, and completely private way to strengthen these essential muscles and regain control. That's where Kegel exercises come in. Named after Dr. Arnold Kegel, the American gynecologist who first described them back in 1948. These exercises are straightforward clench and release movements designed specifically to target and strengthen your pelvic floor muscles. They are a powerful tool for women of all ages, helping to prevent and treat a range of common issues. By dedicating just a few minutes each day to these simple exercises, you can build a stronger foundation from the inside out, improving your health and confidence in ways you might never have imagined possible. It's a secret weapon for your well-being that you can use anywhere, anytime. Oh, before you can start strengthening your pelvic floor, you first need to know exactly which muscles you're supposed to be working. Finding them is the most important step, and thankfully, it's quite simple. The easiest way to identify your pelvic floor muscles is to try and stop your flow of urine the next time you are on the toilet. The muscles you squeeze to do this are the very same ones you need for Kegels. It's important to remember that this is just a test to help you find the right spot. You shouldn't make a habit of doing Kegels while you're urinating, as it could interfere with emptying your bladder properly. Once you've successfully identified the muscles, you can start practicing the exercise. Find a comfortable and quiet place where you can relax, either lying down or sitting in a chair. Now, without tensing your stomach, bottom, or thigh muscles, focus on squeezing those pelvic floor muscles you found earlier. It should feel like a lifting and tightening sensation inside your vagina. Try to hold this contraction for about 3 to 5 seconds. At first, you might only be able to hold it for a second or two, and that's perfectly fine. Just do what you can without straining. After you've held the squeeze, it's just as important to relax the muscles completely. Let go of the contraction and feel the muscles release back to their resting state. You should rest for the same amount of time as you held the contraction, so if you squeezed for 5 seconds, you should relax for 5 seconds. This rest period allows your muscles to recover before the next repetition, which is crucial for building strength effectively. Remember to breathe normally throughout the entire exercise. Don't hold your breath, as this can increase pressure on your abdomen and work against what you're trying to achieve. To make sure you are doing it right, you can also try another method. Insert a clean finger into your vagina and then squeeze, as if you were trying to stop passing wind. You should feel the muscles tighten around your finger if you are contracting the correct ones. Getting the technique right is key to seeing results. It's a subtle movement, and it might take a bit of practice to isolate the right muscles without accidentally using your abs or glutes, but with a little focus, you will get the hang of it and be on your way to building a stronger pelvic floor. Consistently performing Kegel exercises can bring about some truly transformative benefits for your health and well-being, especially as you navigate different stages of life. One of the most significant advantages is improved bladder control. For many women, particularly after childbirth or as they get older, a sudden cough, a hearty laugh, or a jump can cause an unexpected and often embarrassing leak of urine. By strengthening the muscles that support your bladder, Kegels can dramatically reduce or even completely eliminate this type of incontinence, giving you the freedom and confidence to live your life without fear of accidents. The journey of pregnancy and childbirth places immense strain on the pelvic floor. Kegel exercises are incredibly beneficial during this time. Practicing them throughout your pregnancy can help prepare your body for labor and delivery by improving the tone and elasticity of these muscles. After giving birth, continuing with Kegels is essential for postpartum recovery. It helps to heal the tissues, restore muscle strength, and reduce the risk of long-term problems like pelvic organ prolapse, where one or more of the pelvic organs can drop down from their normal position. It's a gentle yet powerful way to help your body recover. Beyond bladder control and postpartum recovery, a strong pelvic floor can also enhance your sexual health. The same muscles that you strengthen with Kegels are also involved in sexual arousal and orgasm. Increased muscle tone in this area can lead to greater sensitivity and stronger, more intense orgasms for some women. It can also contribute to a greater sense of connection and pleasure during intimacy. It's a wonderful and often overlooked benefit that contributes to a woman's overall sexual well-being and confidence, making it a valuable addition to your self-care routine. While the focus is often on women, it's worth noting that weak pelvic floor muscles can affect anyone. Men can also suffer from issues like urinary or fecal incontinence, especially after prostate surgery, and they too can benefit from doing Kegel exercises. For women, the reasons for weakness are varied, from the physical pressures of carrying a baby to hormonal changes during menopause, and even chronic coughing or constipation. Whatever the cause, Kegels offer a proactive solution to support your body's core foundation, empowering you to take control of your health in a profound way. Now that you understand what Kegels are and why they are so important, the next step is to integrate them into your daily life. Like any exercise, consistency is the magic ingredient that leads to real, lasting results. The great thing about Kegels is that they are discreet and can be done almost anywhere without anyone knowing. You can do them while you're sitting at your desk at work, waiting in line at the supermarket, watching television on the sofa, or even while you're brushing your teeth. The key is to find moments in your existing routine where you can easily fit them in. A good goal to start with is to aim for 3 sets of 10 to 15 repetitions each day. This means you'll squeeze, hold, and relax your pelvic floor muscles about 30 to 45 times in total throughout the day. You don't have to do them all at once. You could do 1 set in the morning, 1 in the afternoon, and 1 in the evening. As your muscles get stronger over time, you can gradually increase how long you hold each contraction, working your way up from 5 seconds to 10 seconds for maximum benefit. But remember to listen to your body and avoid overdoing it. It's natural to want to see improvements right away, but building muscle strength takes time and patience. you probably won't notice a difference overnight. Most women start to see significant improvement in their symptoms, such as better bladder control, after about 4 to 6 weeks of doing Kegels consistently every single day. For some, it might take up to 3 months to experience the full benefits. So don't get discouraged if you don't feel a change immediately. Stick with it and trust that you are making a positive investment in your long-term health. Ultimately, the power of Kegel exercises lies in their simplicity and the profound impact they can have on your quality of life. Embracing this small daily habit is an act of self-care that empowers you to support your body from the inside out. It's a reminder that we don't always need grand gestures or complicated routines to make a meaningful difference to our health. Sometimes, the most powerful changes come from the small, consistent efforts we make every day. By committing to your Kegels, you are taking an active role in building a stronger, more confident and healthier you. Click the playlist at the end of the video to learn about pregnancy and pregnancy-related issues.